A 47-year-old auto driver in Chennai has died from rabies despite receiving full vaccination and treatment. The bite came from a stray dog in July. Mohammed Nasarudeen was bitten on his right leg near Ghafoor Sahib Street on 20th of July. He immediately received the RIG, which is rabies immunoglobulin, and the first dose of anti-rabies vaccine at Royapettah Government Hospital. But he later completed all remaining ARV doses, but he died. Now, in August, he developed fever and was admitted to Rajiv Gandhi Government General Hospital, where he was quarantined. On 13th of September, after difficulty in swallowing water and worsening condition, he passed away. His son, Mohammed Nasarudeen, said Nasarudeen had no prior health issues except some kind of a blood pressure issue, which isn't really great. Now, Greater Chennai Corporation confirmed that the dog was not isolated and admitted they are unaware if it was bitten other dogs or people in the area. Now, the World Health Organization notes bites on highly innervated areas like head, neck or hands can allow the rabies virus to reach the brain quickly, reducing the effectiveness of post-exposure prophylaxis even when treatment is timely. Now, I want to understand that the only thing you and I can do if a stray dog bites us is to go take all the doses of the vaccine. But then this man died. Let's find out what may have happened. Dr. Subramanian Swaminathan, Director, Infectious Disease, Gleneagles Hospital, has joined us. We are awaiting other doctor as well. Dr. Subramanian, thank you so much. Long time, it's good to have you back on the show.
Good evening.
Good evening, sir. I want to ask you 3 doses that he took, apparently, and he died. Now, there is a fear amongst people. This is the 22nd case so far in Chennai. What do you think must have gone wrong, sir? Because as I read his case, he apparently, he got bitten, he went in the evening, he got his dosage. Someone can turn around and say, why did he wait? I do not know the time frame. Was it evening? Was it afternoon? Whatever. But what do you, can rabies vaccination fail, Dr. Swaminathan?
Okay. Thank you for having me. So I want to point out a couple of issues. The first thing is that from the looks of it, many things have been done right here. And unfortunately, in every medical condition, in spite of all appropriate steps being taken, sometimes it leads to really difficult situations. No vaccine is 100% perfect. But having said that, whenever we see failures like this, it is usually because there is some gap or mistake that may have inadvertently happened. Now, as far as the timing between the injury and the vaccination, unless it is many days apart, I don't think it's such a big crime. So obviously we prefer it, they come immediately, get the vaccine and things like that. So the first thing is that is one. The second thing is immunoglobulin. If it is a significant injury, in immunoglobulin or the antibody is something which can significantly reduce the risk. And the question is, how was this given? The recommendation is as much of it should be infiltrated into the wound and the rest of it given intramuscularly. So was enough of it infiltrated into the wound? If enough of it was not given into the wound, obviously there can be a bit of a gap over there. The next point is many people prefer having IM injections in their hip. Now, for vaccines, that's actually a bad idea. Vaccines should ideally be given on the shoulder. Shoulder muscle, the efficacy of the vaccine is much better, and almost all vaccines should be given in the shoulder. So if by mistake somebody had given it to him in his gluteus, in his back, then obviously the efficacy may have been poorer. Also, again,
sorry,
I mean,
sir.
I don't.
Yeah, sorry, sir, but these are doctors of government hospital. He went
Yeah.
to Royapettah, right? We presume that they see a lot of cases, every day,
Yes.
perhaps, of rabies, because they have a larger kind of population to see. I trust government hospitals, so sorry for the bias.
Yes.
Now,
Yes.
now the doc there says, and I'm reading it, Somasundaram, he says, we're investigating the case to understand what led to the death in spite of completion of the 4-dose vaccination schedule.
Absolutely.
Now
So the question
that's
is,
a
was
very
enough of the
vague.
antibody given? No, was enough of the antibody given? So if the antibody dose was not adequate, then that's going to be an issue. Also keep in mind, I don't know exactly where the injury happened. If it happened on the leg, it takes a long time for it to, get into the brain, and therefore you have a better chance for the vaccine to kick in. But if it happens in the face or one of the dangerous areas, you may not have enough time for the vaccine to help the patient, and the virus can get into the dangerous places even before the vaccine has an opportunity to help the patient.
All
So there
right,
are
sir.
some technical issues also
You know,
in
I
this.
also I also want to know that the 3 ARV doses that he took,
Mhm.
is there a period that you have to adhere to, or I mean, I don't know, 1 week from now, like 1 week from now, 15 days, fortnight, how
Correct.
does it work?
So the usual schedule is if the first dose is given today as day 0, then the second dose should be on the third day, the third dose should be on the 7th day, and the next dose on the 14th day. Some people even give a fifth dose, but a minimum of 4 doses is required.
Now, what happens is that this man, of course, he took all the doses, and one doesn't know. I mean, poor man. But his son says that then he went to another hospital, and they told
Right?
him about the dog bite, and this is when he started experiences back pain. Then what is
Yes.
which I've read about is that you feel disoriented. You are like,
Yes.
there is slurring of speech. There are other symptoms. You are delusional, disoriented, etc., 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 which happens.
Yes.
So would you say that by then, is that a big, like a red flag that something's happening?
So there are a couple of points here. Number one, by the time these things start happening, the rabies has already taken hold in the patient, and the chance of survival there is almost impossible. Less than 5 people so far have survived rabies. So, I mean, I don't think there is much of a point in wondering about what to do after rabies has taken hold. The second thing is like today a lot of doctors may have come through their training program without having seen a rabies patient. So, therefore, not everybody would know what a rabies is. So, sometimes many of the younger doctors they may not be familiar with the initial starting symptoms of rabies. Difficulty swallowing water and air problems and all that everybody knows. But the initial starting symptoms may be very, very mild and may be missed by people who don't have experience in this. So I'm not surprised that they may not have thought of rabies at that point of time.
A man died. Dr. Ishwar Gilada is also joining us, consulted infectious diseases. Dr. Gilada, we were waiting for you and happy to have you on the show, but I've completely run out of time. Dr. Gilada, I want to ask you before I let both of you go, doctors, that this is such a tragic case. And, Dr. Swaminathan explained that there could be different reasons for it, maybe the training also. I mean, I like that he puts the onus also on the medical professionals and profession. Dr. Gilada, one of the main reasons we have also read, and when the stray dog was there, that the temperature at which the vaccination is stored is also very, very crucial. Do you think that could be one of the reasons, Dr. Gilada?
Yeah, that is one of the reasons, because in many places, if they don't have a proper electrical supply, electricity goes off. And it must have gone off a month before, 2 months before. And because the vaccines are expensive, nobody would discard them. So that can be efficiency problem.
But
But as Dr.
but
Yeah.
Dr. Gilada, how will I know if my son gets bitten tomorrow? All these questions. I just go to a hospital, I wash it with soap and water, and I say injection laga do. Now, onus is on the hospital and the doctors. No, sir, it's not on me.
No. Onus is on the vaccine manufacturer, doctor, storage people, or hospital, because most of the hospitals are not run by doctors. A lot of times we make a mistake of only blaming on doctors. If hospital is run by a business person who is not of a medical background, and they come to know that some loss is going to be there because of electricity has gone, they would say, no, koi baat nahi, use kar lo, and blame will come on doctor. So we need to be very, very particular about that. We should carry kind of warning signs that these are not to be used if at all electricity has gone for a few hours. There should be some studies to understand that at what particular temperature it will not start working. So I think those studies, even as a doctor, will not know. Will know that only vaccine is used and it has come from a refrigerator. If refrigerator was not working for a couple of days or maybe 4 hours, if the temperature is variant, we do not know whether it is efficient or not. But as far
Poor
as
man.
vaccine
Yeah.
is concerned,
And the poor man, doctor, he had no kind of, except for blood pressure, he had no other, 47 is no age to die. He's an auto rickshaw driver. He was bitten on his right leg. Now, no, it's a mystery. And I think everyone needs to sit around and find out what really went wrong, because this seems to be a case where, despite having done all the right things, Dr. Swaminathan said vaccination is not 100%. But the point is that, don't you think that something may have gone wrong here, Dr. Gilada, on the part of the patient also?
Something which has gone wrong is that there are two ways. One is, there are people, if we start telling people that you remove the street dogs or vasectomize them or stop their population, their animal lovers will come and say, no, 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 this cannot be done. So I think this is a dichotomy. We have all kind of people. Those like us, we are caring more human beings, and we don't want them to die of rabies because it's a 100% killer disease. Dr. Swaminathan said there are 5 cases of survival. So it's the 0% survival basically, if you talk in percentage. In that situation, we must take care of street dogs. Street dogs should be firstly vasectomized so that they do not produce, and secondly, they should be all 100% vaccinated. Now, how that can be done, how that can be achieved, is the state machinery has to decide.